Learn everything there is to know about pneumonia in this video. What is pneumonia? Pneumonia is a lung infection that can range from mild to severe. It occurs when an infection causes fluid or pus to collect in the lung alveoli, which are small air sacs inside the lungs. You may find it difficult to breathe inadequate oxygen in your bloodstream as a result. This infectious disease can affect anyone. Infants under 2 years old and those over 65 are particularly vulnerable. That is due to the possibility that their immune systems are powerless to combat it. Pneumonia can affect one or both of your lungs and can be classified according to location of infection into 3 main types: lobar pneumonia, bronchopneumonia, and interstitial pneumonia. Lobar pneumonia is an inflammation affecting one or more sections or lobes of the lung. Bronchopneumonia is an inflammatory response due to colonization of microorganisms into the terminal bronchioles and extension of it into the surrounding alveoli, resulting in patchy consolidation. Interstitial pneumonia is an inflammatory process, which is confined to interstitial tissue between the alveoli, with absence of alveolar exudate. It can involve one or both lungs. Bacteria, viruses, and fungus can bring on pneumonia. You can spread pneumonia to someone else if bacteria or a virus causes it. What are the causes of pneumonia? According on the types of germs that cause illness and how you contracted the infection, there are several varieties of pneumonia. Community-acquired pneumonia, the most prevalent kind of pneumonia, is the first type. It takes place apart from hospitals or other medical institutions. Bacteria, bacterium-like organisms, viruses, and fungus can bring it on. A bacterium known as Streptococcus pneumonia is the most frequent cause of bacterial pneumonia. Mycoplasma pneumonia is the most prevalent variety of bacteria-like organisms that can cause pneumonia. Compared to other varieties of pneumonia, it often causes fewer severe symptoms. Several of the viruses that cause colds and the flu can bring on pneumonia. The most frequent type of pneumonia in children under the age of 5 is viral pneumonia. Although viral pneumonia often has a mild prognosis, in some situations it can be very dangerous. Pneumonia brought on by the coronavirus or COVID-19 may be severe. Fungi can bring on pneumonia. People with compromised immune systems, chronic health conditions, and those who have breathed high concentrations of the organisms are more likely to develop fungal pneumonia. Pneumonia-causing fungi can be found in bird droppings or soil. Hospital-acquired pneumonia is the second variety of pneumonia. Some patients who are in the hospital for another sickness also develop pneumonia. Because the individuals who contract it are already ill, and because the bacteria that cause it may be more resistant to treatments, hospital-acquired pneumonia can be serious. This type of pneumonia is more common in those who use ventilators, which are breathing machines frequently used in intensive care units. Aspiration pneumonia, the third kind of pneumonia, develops when you breathe in food, drink, vomit, or saliva into your lungs. If something interferes with your natural gag response, such as a brain damage, swallowing issues, heavy alcohol or drug use, or any of these, aspiration pneumonia is more likely to occur. What are the signs and symptoms of pneumonia? Pneumonia symptoms can range from minor to severe, depending on your age and the type of germ that is infecting you. Fatigue, fever, sweating and trembling, chills, chest pain when you breathe or cough, shortness of breath, and a cough that may produce phlegm are some of the symptoms and signs of pneumonia. Anyone can contract pneumonia. However, children under 2 and persons 65 years of age or older are the 2 age groups most at danger. Hospitalization, smoking, a weaker or suppressed immune system, and chronic illnesses such bronchial asthma, chronic obstructive pulmonary disease, or heart disease are additional risk factors for pneumonia. What are the pneumonia complications? Even with treatment, some pneumonia sufferers, particularly those in high-risk groups, may still experience complications like breathing difficulties, lung abscesses, fluid buildup around the lungs, a condition known as pleural effusion, and bacteremia, which means the bacteria have spread to the bloodstream. There are vaccines available to protect against some strains of the flu and pneumonia. What about a pneumonia diagnosis? Your doctor may order the following tests if pneumonia is suspected: a chest X-ray or CT scan, a sputum test, and a pleural fluid culture if present. What about pneumonia treatment? The kind and severity of your pneumonia, your age, and your general health will all influence the specific therapies you receive. Antibiotics, cough syrup, antipyretics, and analgesics are available options. Hospitalization may be required, particularly in complex instances or cases involving patients older than 65. If you need to be hooked up to a ventilator, a breathing machine, you can be admitted to the intensive care unit. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.